I think that teams need to be very broad because they might need expertise from lots of people. So for example, this woman developed very bad neuropathy. So one of the experts talked about the problems with neuropathy and really the data to support dealing with it. And with a lot of modern treatments, neuropathy is a huge problem for patients. So you might also need pain specialists. This woman needed expert dietetic involvement. And so I think one of the really big lessons from the symposium, for me and for many people in the audience, was actually you need to build the links to these people so that you have people who are expert who can come in and help you when you need them, rather than either ignoring the problem completely and hoping it'll go away, which it often doesn't. Sometimes it will, but often it won't. Or desperately seeking someone who hasn't got expertise in this area who can come in and help. The data that are available say that somewhere between 5 and 40% of MDT decisions are changed by having the right person in that group. So a lot of cancer physicians spend a lot of time in multidisciplinary team meetings deciding what the best treatment is for patients. Not so many of them spend time once the patient has started the journey and when complications have arisen with that appropriate MDT group. But if at the beginning of the journey the MDT decision changes it in up to 40% of cases, how good would it be to have an MDT which could deal with side effects of cancer treatment and it had the same impact? Because if it did, people would be much happier, they would have a better quality of life as they go through their quite difficult treatment, and probably they would get more chemotherapy, they'd be less likely to have dose reductions, and probably that would lead to better outcomes. And most of those things have not ever been measured, but if they could be measured, I think that would be something really exciting. And now that there are some really truly effective cancer treatments, it is very, very important that we start to focus more on quality of life as patients go through that treatment. People need to think much more broadly when they're treating oncology than we have been up to now.